All right, let's talk about this current wave of Omicron and this idea that it is a less severe variant of COVID. So first of all, do we think it is, and how does that matter?
I think it is. There was a study that just came out of Cleveland looking at Delta as compared to Omicron to see whether there were differences in terms of likelihood of being hospitalized, likelihood of going to the intensive care unit, likelihood of mechanical ventilation, likelihood of death. And what they found was that when you compared Delta to Omicron, Omicron was less virulent in all of those categories and for all ages. But it is a little hard to separate it out because we have more population immunity, meaning people who've been naturally infected or people who've been immunized or both. And so that's going to then modify your exposure to the virus. Remember, the thing about Omicron that's particularly heinous, we all talk about how it's more contagious, but technically really what it is it's much more likely to infect and cause mild disease in somebody who's already vaccinated, much more so than Delta. If you're already vaccinated or naturally infected, you're more likely to be protected against mild disease than if you're infected with or exposed to Omicron.
Now, is it true that Omicron is in a different area, that it's affecting the lungs in a different way than other variants have?
Right, so certainly in our hospital, Children's Hospital of Philadelphia, when we see children come into our hospital infected with Omicron, what we see mostly is croup and bronchiolitis. Bronchiolitis is inflammation of the windpipe and then sort of the first and second branches of the lungs. But we're not seeing as much pneumonia, which is more of what we saw with Delta and with Alpha and with the first variant. And there's a laboratory work that it's consistent with that, in that if you look in the laboratory, this virus is more likely to be able to reproduce itself in the cells that line the upper respiratory tract, but not so much in lung cells.
But the sheer volume of people that are coming into the hospital, that still poses a threat, right? Just a capacity issue.
Yes, definitely. I can tell you that it's definitely true in our hospital. And there are states, probably 18 states now, that are right on the verge of code red, meaning no more elective surgeries. I think, what we're seeing this flood of cases. And the difference is, first of all, it's a winter virus. COVID is a winter virus. Last winter, when we did things not only masked and social distance, but shut down schools, shut down businesses, restricted travel, we really virtually eliminated many of those other winter respiratory viruses like influenza, respiratory syncytial virus, parainfluenza virus, adenovirus. I mean, to put this in context, every year influenza kills 75 to 150 children in this country. Last year, it killed one. I mean, that's how much influenza virtually disappeared based on what we did. We're not doing that this winter. I mean, many of us are just sort of living our normal lives. Everybody is attending sporting events and going traveling as much as ever. So our behavior is different, and it's a winter virus, and there's these other viruses going on. And we still have way too many people in this country who are unvaccinated, that serve as probably the principal source of spread.
Now, last year we were worried that flu was going to meet COVID and we were going to have this twindemic. But this year we actually have the flu meeting COVID. So how serious is that if you get both of these viruses at the same time?
Right, is typically more serious. And it's not unusual to be able to be infected with two respiratory viruses at once. I mean, we screen children who come into our hospital for a variety of viruses and can occasionally find that they're infected with two. And it is worse to be infected with two. So yes, I think that's the difference between this winter and last winter, when we were much better at sort of restricting our ability to interact with each other than we are this winter. So you're seeing all the winter viruses come back.
And what about the fact that it seems to be hitting younger people, including we're seeing, more of the kids being infected this time?
Right, they're the susceptible group. I mean, we talk endlessly about sort of groups that are most at risk. So people will say an African American community, or sometimes a highly religious Orthodox or ultra-Orthodox Jewish community, or an evangelical Christian community, or an Amish community. I mean, we constantly read about that. But the group that is the least likely to be vaccinated are people less than 30. And so this virus has now sought out that susceptible group.